Hi, welcome back to my YouTube channel. So, as we said last time, the next video was going to be what causes high blood pressure. So, this is a video for it. So, we'll be talking about hypertension and what makes the blood pressure high and what you can do. So, so let's start with explaining what is blood pressure. So blood pressure is a measure of how much force your blood exert against the wall of your arteries as your heart pumps it throughout your body. So blood pressure changes with every single heartbeat, or basically happens with every single heartbeat. And the standard measurement for blood pressure is mmHg, or millimeters of mercury. So here are just the basic parts of an artery, and this is a vein. Like if you cut it up, this was how a vein would look like, and this is how an artery would look like. Yeah. So understanding the numbers. So whenever you check your blood pressure, it shows two numbers, the top number and the bottom number. But you need to understand what those mean. So the top number is the systolic number. It measures pressures in your arteries when your heart beats and pumps out blood. And the bottom number, which is diastolic, it measures pressure in your arteries when your heart rests between beats. So the healthy heartbeat, like the ideal numbers, is 120 out of 80 for adults, and that's the ideal healthy level. So what causes high blood pressure? So also known as hypertension, this is when the force of blood remains too high for too long. So the issue of high blood pressure is your arteries experience chronic stress. Your heart must work significantly harder to pump, and the walls thicken and become less flexible. So here's just the photos of hypertension and then like the issues. So now we'll talk about the causes of high blood pressure. We have three causes. The first cause is too much salt. So, sodium acts, so one of them is water retention. So, too much salt acts like a sponge because sodium acts like a sponge and it pulls water into your bloodstream. And then more water means more fluid in your pipes. And then the pipes are the blood vessels. And then there's going to be a pressure spike, which is an increased volume lead to higher pressure against artery walls. So number two is lifestyle factors. So basically, your daily life. So one of them is obesity, which is that excess weight forces the heart to pump more blood to supply the extra tissue, placing a heavy load on the entire system. And then inactivity, so lack of exercise causes blood vessels to lose their elasticity and stiffen, making it harder for blood to flow smoothly. And then our final cause is stress. So the adrenaline effect is one of the most important ones of high blood pressure. So when you're stressed, your body releases hormones like adrenaline and cortisol. So your heartbeat accelerates rapidly when you have stress, and the blood vessels narrow and constrict. And then this dual effect causes a temporary but sharp rise in blood pressure. So, one of the other causes would be with smoking. So, smoking, as you know, it's going to cause damage to your heart. And so, tobacco smoke containing chemicals that directly injure the lining of your artery walls. So, like your heart rate's going to increase due to the nicotine. And then it's atherosclerosis, which is basically it speeds up the hardening of the arteries, and then you're at chronic risk, which greatly increases the chance of permanent hypertension. So why hypertension is dangerous? So four things that could happen. First is heart attack. So as we talked last time, it's gonna stop your blood flow to your heart muscle. And then a stroke could happen, which the vessels in your brain gets damaged. And then kidney damage, which is failure of vital filtering units. And then heart failure, so your heart just gives up and quits. So we to recap everything, the causes of a high blood pressure is salt, inactivity, stress, and smoking. And so do not so these are like what's gonna cause blood pressure. So to make sure this is balanced out with less salt and have more activity. And if you have blood pressure, decrease amount of stress, maybe go take a walk and then stop smoking. So next video will be what happens during a stroke. And then these are my image sources.